Hello everyone. Today I will demonstrate the anatomy of the gluteal region with the help of cadaveric images. The bulkiest muscle visible here is the gluteus maximus. It is the most superficial muscle of the gluteal region. The orientation of this image is superior towards the trunk, inferior towards the thigh, with medial and lateral aspects clearly appreciated. Notice how the muscle fasciculi run obliquely downwards from medial to lateral, inserting into the iliotibial tract and the gluteal tuberosity. This is the lateral view of the thigh, showing the thick vertical fibrous band known as the iliotibial tract. The iliotibial tract is a modification of the deep fascia or fascia lata of the thigh. On the posterior aspect, the insertion of the gluteus maximus muscle into the iliotibial tract is clearly demonstrated in this image. The iliotibial tract also receives the attachment of the tensor fascia lata from above. Additionally, the thin, slender nerve seen superficially on the posterior aspect of the thigh, emerging from the lower border of the gluteus maximus, is the posterior cutaneous nerve of the thigh. This specimen demonstrates the structures deep to the gluteus maximus. It is a lateral view with the orientation as follows: superior towards the trunk, inferior towards the thigh, the greater trochanter marking the lateral aspect, and the sciatic nerve lying on the medial side. Here the gluteus maximus has been cut and reflected to reveal the deeper structures. The cut end of its insertion can be clearly seen. The large fan-shaped muscle converging towards and inserting into the greater trochanter is the gluteus medius. The smaller piriform or triangular muscle is the piriformis. Piriformis is considered the key muscle of the gluteal region, as it divides the neurovascular structures above and below it. The artery emerging along the upper border of the piriformis is the superior gluteal artery. Below the piriformis lies the inferior gluteal artery, accompanied by the inferior gluteal nerve. The thick nerve observed below the piriformis is the sciatic nerve. Medial to the sciatic nerve runs the posterior cutaneous nerve of the thigh. Now let us proceed with further dissection by reflecting the gluteus medius. In this image, we can appreciate the reflected gluteus medius, along with the reflected part of the gluteus maximus. The fan-shaped muscle visible here is the gluteus minimus, which converges toward the greater trochanter. The piriformis muscle is also seen attaching to the greater trochanter. Between the gluteus minimus and the piriformis lie important neurovascular structures. The blood vessel observed is the superior gluteal artery, which divides into superficial and deep branches. The superficial branches pierce the gluteus maximus, while the deep branches supply the gluteus medius and gluteus minimus. The nerve accompanying this artery is the superior gluteal nerve. The superior gluteal nerve provides innervation to both the gluteus medius and gluteus minimus. Below the lower border of the piriformis, the sciatic nerve and the posterior cutaneous nerve of the thigh can also be identified. This image demonstrates the structures lying below the lower border of the piriformis. Before identifying the neurovascular structures, let us begin with the muscles forming the lower part of the gluteal region, deep to the gluteus maximus. Immediately below the lower border of the piriformis, three muscles can be seen together: the obturator internus, the superior gemellus, and the inferior gemellus. These three muscles unite to form a common tricipital tendon before attaching to the greater trochanter. The muscle located just below this tricipital tendon is the quadratus femoris. Beneath the quadratus femoris, a small portion of the adductor magnus is also visible. Among the nerves, the thick nerve emerging below the piriformis is the sciatic nerve. Associated with the sciatic nerve are the posterior cutaneous nerve of the thigh and the inferior gluteal nerve accompanied by the inferior gluteal artery. The fibrous band seen medial to the sciatic nerve is the sacrotuberous ligament. Closely related to this ligament is the pudendal nerve, which continues medially along with the internal pudendal artery. This completes the demonstration of the gluteal region. Thank you.